Mental health needs attention, because if we don't give the attention, it will not seek the attention. A lot of times when you have a problem, you get to see the problem is a lot more visible. This is invisible. And we make it even more invisible by some of our social norms and rituals. So we need to begin to create awareness and provide help. But most importantly, we need to make sure that the care is available on a sustainable basis. This is not a pill that you can take and walk away. I would clearly venture to say, based on the study that we have done, that while on one hand primary care clinics are a great avenue for providing access to mental health care, but when you get into that clinic, one needs to recognize that physical health and mental health care and delivery are not necessarily, are sort of oil and water, actually. They cannot just be mixed. The modalities of care cannot be the one and the same. If you do it, then I think you are doing a disservice to the patient and to the community. It is also important, therefore, to start thinking in terms on the demand side, to make sure you educate, you create this awareness in people to be all right that you have a mental health condition. It's all right, and to come out of it, because that makes us, researchers like to understand what the demand side, because the demand forecast is so conservative in ways that is unfathomable. Why? If you have a normal physical health condition, at some point it's going to hurt you or you cannot walk, or there is some debilitating condition that your mental faculty are working, so you essentially will reach out, or somebody will drag you to say, hey, you need to get care, right? That's not the case. Sometimes mental condition people tend to withdraw, right? So this creating the awareness and creating awareness to the point that individuals having reach out, seek care, other people accept them for who they are and actually celebrate for all the great things that they do. On the supply side, it's very important to make sure that today, for example, if you go to a typical public school and you look at just the sheer volume of students that, say, a counselor had to deal, it's completely unfathomable. The ratio is completely out. So one counselor per hundreds of students. I think we need to start doing something. And this is not just a council, it's everybody's problem, right? Every student, as much as every student in the classroom, every teacher, doesn't matter, needs to understand, because that's where it begins. A lot of those things begin, ironically, in schools right now.